Welcome, everyone. We're so excited that you have taken some time to attend this webinar, The Disconnected Connections, the Impact of Screen Time on Young Children's Social Emotional Well-Being. My name is Jackie Eaton, and I am the Community Action Program for Children Training and Education Coordinator at the Saskatchewan Prevention Institute. And before we begin, I would just like to go over a couple housekeeping things. So you would have noticed when you entered the webinar, this webinar is being recorded, and the link will be sent out to all registrants. It will also be available on the Saskatchewan Prevention Institute's website. Probably takes at least 2-3 days, but then you'll be able to share that with your colleagues and networks if you're interested. All participants are muted. So if you have any questions, please use the Q&A function at the bottom of the screen. You'll see a Q&A box. So if you have questions, if you put those in there, and then at the end of the webinar, Dr. Talwar will answer the questions. So feel free to enter any questions there. Please use the chat to connect with other participants who are attending, or if you have any technical issues or difficulties, I'll be monitoring the chat. If you are like me and you're watching a webinar and you don't want to pay any attention to the chat, you can click on the chat. There's a little arrow on the right-hand side of the chat button at the bottom of your screen. If you click on that, you'll see where it says Show Chat Preview. You click on that, it'll take it off. The chat will still be running. You'll see that number increase, but you won't get that running scroll at the bottom of your screen if that's something you wish to avoid. All right, so to get us started in a good way, I just want to take a moment to pause and to think of the land that we are currently on. So I'm honored. I am on Treaty 6 in the homeland of Métis. And I work at the Saskatchewan Prevention Institute, which is a provincial nonprofit organization. So we provide services to people in treaty lands 2, 4, 5, 6, 8, and 10, as well as the homeland of the Métis. We are honored that the people on those treaties, on these ancestral territories of the Nahiawuk, Nahithawuk, Nahinawuk, Ananeshbek, Nekaway, Dakota, Lakota, Nakota, Dene, and the homeland of the Métis that we're able to be on this land and share this land. We recognize that these lands are currently inhabited by Indigenous peoples from across Turtle Island, including many other First Nations and Inuit peoples. And we acknowledge the importance of the treaties, the lasting impacts of colonialization, and the continued inequities. We are dedicated to moving forward on a shared path of reconciliation and partnership. We are all treaty people, and we are grateful to live, work, and play on this land. So I invite you to take a moment to consider the land that you are currently participating from. If you feel comfortable and wish to do so, feel free to share that in the chat. And I was sharing with Victoria how excited I was, the number of people that have registered for this webinar. And so I recognize some of the names for sure, but I know there's many people that I have not had the opportunity or the pleasure of meeting in the past. So I'm going to share a short video of the Saskatchewan Prevention Institute and what we do. And hopefully this all works. We tried it out before, so I'll take this out.
Think about the role you play in creating environments and opportunities that support children, youth, and families. As a provincial nonprofit organization, we support service providers, educators, and communities to increase the health and well-being of children, from preconception through childhood. At the Saskatchewan Prevention Institute, This vision has guided us since 1980. We offer more than just information. Our unique approach turns research and evidence into practical, easy-to-use resources that will inform your work and can be shared with families and communities. We also provide education and training opportunities on a wide range of topics to help you stay at the forefront of best practices in your field. Visit us online to learn more about how we can support you in building healthier communities across Saskatchewan.
Imagine a world where every child grows up healthy, safe, and able to achieve their full potential.
Our goal is healthy children.
Okay. So now it is my true pleasure to introduce Dr. Victoria Talwar. She is a professor, the Canada Research Chair, and Director of the Gold Centre for Early Childhood Development at McGill University. Her research is in the area of developmental psychology with an emphasis on children's social emotional development. And I've had the pleasure of having a few moments to connect with her, and I'm very excited that she is able to be here today to talk about a topic that we know at the Prevention Institute is of great interest for many people. So I'll hand it on to you, Victoria.
Great. Thank you very much, Jackie. Well, it's a pleasure to be here with you all today to talk about a topic that I think is we all think about, both in our professional lives, but also in our personal lives, because this has become something that we really are grappling with as we live in this very, very fast-moving digital world. So today I'm going to talk, my focus is going to be on the impact of screen time on young children's social emotional well-being in particular. So as I said, technology and media have become a vital part of our lives. And this includes infants, toddlers, preschoolers, school-age children, teenagers, and adults. And we think of screen time, there's been a proliferation now of how media impacts our lives in so many ways. And we think of screen time, in the past, our parents used to think of one thing. They used to think of the television. That was the screen in the house. But now screen time is any screen, and this includes the television, but it also includes our phones, computers, tablets, gaming, or mobile devices. We can use it for a variety of purposes. Some of it's educational, but we can also use it to connect with others through social media. So it's become a very pervasive part of our lives. I used to talk about it, I've been talking about sort of screen time for a while, and I used to talk about it as kind of being this other kind of context, especially for youth. But really now, and especially for youth, it is part of their everyday life. Like this is where they live. They live online. So it's not even a separate kind of part of our lives. It really is an integrated part of our lives. But for young children, television and watching video online actually still accounts for a large part, the majority of their screen time. According to research in the US, about 74% of parents report that their children are under 2 are watching, if they're watching things, it's videos or television. But one thing that I want to caveat as we go on is that sometimes we don't always think about all the way that we have screen time, and parents don't always think about all the way that their children are exposed to screen time. So there are different definitions of screen time. But one thing that we also have to consider is that children's screen, it doesn't always have to be children looking at a screen. Children can be having screen time or exposed to screen time even when it's adult screen time. So for instance, in this picture, you see a father here, he may be doing work, or he might be just watching a video that his friend sent him, or doing something online, and the child is can be exposed to that. In fact, one study found in the US that 46% of mothers reported watching television while they breastfeed in their sample, and 38% of kids watch television while eating. So there can be this sort of passive screen time or this sort of secondary screen time that children are exposed to when adults are watching television or have media playing. So, like I said, the thing is that most research, there is no one set definition of sort of screen time or how, when people are doing research, how they define it, or what are high amounts of screen time. So that also can lead to variations and differences in findings. But also, this is a very much a changing landscape. So, I've tried to today, as much as possible, to highlight research that's sort of come out since the pandemic, or some of it's come out during the pandemic, which may report some sort of pre-pandemic data as well. But I think that, as we go on, there's a lot of data still to come out. It takes time for researchers, for us to do the peer review process and get things published. There's a lot of data that is going to come out, I think, in the next 5 years that's going to give us an even better picture of the impacts of screen time and the more nuanced picture. But what I'm talking about today is what we know thus far based on the research. So this study, just in terms of screen time use, just to give you some sense of numbers, but keep in mind that this is a changing landscape and, is very fluid. And in fact, screens are becoming more and more integrated in our lives. So these numbers may actually even be higher. This study is sort of came out during the pandemic. So it would be pre-pandemic numbers. And you can see that this is a US sample. So about half, 56% of parents said their children under 2 had no screen time. 13% was less than 1 hour, 20% were reporting 1 to 2 hours, 4% were 2 to 4 hours, and 7% were reporting over 4 hours, which is very excessive. Just to give you an idea of sort of more Canadian numbers, the Canadian Pediatric Society, in their report that came out in 2023, reported that nearly all children in Canada are exposed to screens by the age of 2, and that only 15% of Canadian children aged 3 to 4 met the screen time guidelines of less than 1 hour per day. So you can see that screen time is a prevalent part of it, and I would suggest is probably even more so as we go on. The other thing that the Canadian Pediatric Society highlighted was that in their in the Canadian samples, that again we see that TV, tablets, and video portals make up the dominant amount of the screen time. So this is but before I go on, I just want to highlight that there is some good news, because we're about to talk about some of the negative aspects of screen time. The fact is that children develop in an environment of relationships, and these are very important to nurturing children's well-being and their development. Increasingly, the relationships that children have include their relationships with screens, and indeed their earliest encounters with these screens can have a formative impact on them. But because screens are largely controlled by parents at this young age, children's exposure is easily more modifiable at this age than later on. So that's really the good news to give parents at this age, is that it's much easier to get control of sort of one's screen time at this age. So the reason that early childhood is of particular concern with screens is because early childhood represents a sensitive period of brain development where there's heightened brain plasticity. So we're having critical brain growth. That is, there's growth in gray matter, there's increased myelination, which are all happening in this sort of early years, 0 to 2. And what the child experiences can powerfully shape and influence the brain development, both structurally and functionally. So the concern is that screen use before age 2 may disrupt brain development and lead to more behavioral issues. And that is what the research is starting to show. Although, of course, we need a lot more research on the long-term effects of early screen exposure. So screen time, research has shown that screen time may impact sort of all the different areas of developmental domains. It can lead to difficulty. So in terms of development delays, we talk about cognitive. So it can lead to problems in terms of memory, problem solving, reasoning types of problems, language. It may interfere with the development of understanding words and comprehension in speech, vocabulary, the social emotional domains. In terms of relationships with others around them, the adults and their peers. And it also can impact in terms of physical development, in terms of motor skills and perceptual skills. And so for these reasons, there are very strong recommendations to avoid screen time under 2 years of age and to limit it for young children. So just to give you an example to start off with some Canadian data, this is a study that came out of researchers in Calgary, and they looked at the association between the hours of screen time and children's development and behavioral outcomes at 36 months of age. So they looked at the amount of screen time that parents were reporting children were having. And you see here, the green is under an hour at 3 years of age, and this is about the half of the sample, 47%. You can see the yellow is about 2 hours a day on average, and that's about a third of the sample, 36%. And for 3 hours plus, that was about 17% of their sample. And they looked at it and they found that so the yellow pie is sort of 2 hours plus, those children who had about 2 hours on average a day at this age of 3 years, they had found that they scored higher in the risk range for internalizing and externalizing problems, and also delays in developmental milestone achievement. For those that were in the 3 hour plus, they found that they had an even greater risk range in terms of internalizing, externalizing, and delays in a developmental milestone achievement. And they also found that these children had language delays. So if we look at another study, this is done with Russian Serbian children that just came out recently. They looked at, these are children between 5 and 6 years of age, and they had parent reports of screen times, and they also did children's measures of their cognitive abilities. So this included executive functioning, which are, goal-oriented behavior that are really important for children's sort of later success and ability to achieve goals and academic success. And they looked at, for instance, cognitive flexibility, which is, being able to focus attention in a rapid manner and be able to switch perspectives and adapt to sort of new demands of the situation. Their visual and working memory, so their short-term maintenance and usage of sort of task-pertinent information, and also inhibition, which is their ability to, suppress sort of distracting stimuli, to be able to manage their attention, behavior, and thoughts and emotions. So it's related to self-regulation. And what they found was that, first of all, they looked at the screen time reports and what parents were reporting, and they sort of categorized screen time into two different ways. They said they looked at parent reported their kids were doing passive screen time, which they defined as sort of just basically watching videos, watching content, and also active screen time, which was any sort of screen time that involved sort of cognitive or physical interactions, such as playing interactive games or using educational apps, video chats with another person. And what they found was overall, in terms of overall screen time, participants spent approximately 2 hours in both active and passive screen time per day. But they found a difference between boys and girls in terms of active screen time. Boys were spending much more time in active screen time than girls. They then looked at this in terms of these different sort of abilities, and they found that Children who had passive and active screen time both predicted decreases in cognitive flexibility. Both passive and active screen time predicted decreases in verbal working memory. And they also found that passive screen time predicted decreases in inhibition, self-regulation. So this is gives you a flavor of what the research is showing and how it's really negatively impacting the sort of development in young children in terms of these really pertinent tasks that they have to learn to develop, these skills that they learn to develop at this age. And one of the theories of why this is the idea of displacement. That screen time can basically mean that they are spending less time directly interacting with the parent or the caregiver, and this leads to displacement. The child-caregiver interaction is really important. It's of fundamental importance at this age to critical social-emotional developmental tasks that children are learning at this age. And this may be disrupting that and displacing that because they're just, instead of interacting, they're just watching this screen. And so with this idea, you know, even an app that is considered harmless or even touted as educational, this simple displacement or disruption to the child caregiver interaction can pose risk to the child. So in a study done in New Zealand, they looked at sort of both outcome variables in terms of language and parent-child relations, and they looked for evidence of displacement in children 3 to 5 years of age. And they had parents' reports of their screen time, as well as tests in children of their language ability and comprehension. And they looked at also the parent-child relationship. And they found that preschooler screen time led to reduced opportunities for quality interaction. So they found that both television viewing and electronic media use, they looked at both of these separately, and they found that both of them predicted decreases in language production and also negatively impacted the parent-child closeness. Furthermore, they found support for the displacement hypothesis with significant interactions between with significant indirect effects of screen time on language and parent closeness through reductions in shared reading and quality child interactions. So this is showing you that because the kids are busy on the screens, they're having less time interacting with the caregiver. So, and they're not doing interactive activities such as shared reading and quality interactions with their caregiver. And because of this is leading to these decreases in language production and also affecting the parent-child relationship because they had reduced parent-child closeness. So basically, when they're spending time on screens, that means that they're spending less time interacting with their caregiver. And this is really, really important at this young age. In terms of brain development, a lot of the inputs that are coming into the child are coming from their interactions. We are hardwired to interact with people around us. And so a lot of the learning that children at this young age need to do is through these quality interactions with their, with adults and caregivers and also with the peers. So at this age, they have key developmental social emotional learning that they are doing. They're learning to identify and label emotions in themselves and others. They're also learning to regulate their intense emotions through co-regulation with the caregiver. And they're learning to practice social problem solving skills. They're learning things like empathy, helping, and other pro-social behaviors. And they're also developing sort of regular circadian rhythms and sleep critical for brain and emotional health. And all of these require in-person live interactions with human caregivers. And they are not things that screens can provide. And there is a concern that as a result, screens interfere with this because they mean less time interacting with the caregiver and with live in-person interactions. In another study that was done with Turkish preschoolers. They looked at the mothers and their children were between 2 and 5 years of age. And they, out of their sample that they had, they sort of segmented two groups off. One was parents who had low screen time. And others were those that had high screen time. And they found that parents in low screen time, they reported actually doing more co-viewing with their children. So when they were on screens, when the children were on screens, they were often on the screens at the same time with the parent, and the parent was co-viewing whatever material they were doing. And about 71% of them were doing this, whereas in the high screen time, there was a lot less co-viewing. So only about 24% of them were doing any co-viewing. So most of the time, that high screen time was the child on their own looking at screens. And they also looked at their sort of, they gave them the children the strength and difficulties questionnaire. And they found that children with excessive screen time was linked to more emotional conduct and peer problems. They also had a total overall difficulty score was also elevated. But they found no differences in terms of hyperactivity or pro-social scores. And this was true even after they adjusted for a number of factors, such as gender, age, educational level of parents, birth order, number of family members, prime caretaker status, the age of the first electronic screen exposure, co-viewing with parents, screen contents, daily screen time, etc. So what it suggested that basically, and when they did that, they found that in particular what remained strong when they adjusted for all those different factors was conduct problems and peer relationship problems. And so it seemed that in this sample, excessive screen time, children were more likely, significantly more likely to have poor psychosocial well-being. And it certainly suggests this, along with the with other research that is now coming out, that if you're seeing children with behavioral problems, one factor to evaluate is whether they are getting excessive screen time. In another study that came out had a large population. It was Chinese study. They looked at the association between excessive screen time and health-related quality of life and behavioral problems. And in this study, they defined excessive screen time as an hour plus per day. And they also they wanted to tease out the effects of excessive screen time and early exposure. So they also looked at early exposure, which they defined as if the children were exposed to screen time before 2 years of age. And they found that for excessive screen time, this was linked to, even after adjusting for all these different confounds, children with excessive screen time had poor emotional functioning. They found evidence for poor social functioning, school functioning, and physical functioning. They also found that with early exposure, there was lower emotional functioning, and these children across the board had more behavioral problems. So that included conduct, learning difficulties, psychosomatic, impulsive, hyperactive, anxiety, and hyperactive. And they were also interested in so they looked at these separately to see how excessive screen time versus early exposure impacted independently. But they also wanted to look at interactive effects. And they found that when they looked at the interactive effects, these led to poor emotional functioning and also conduct problems. So it seems that excessive screen time and early exposure are found to have both independent and interactive effects in terms of children's psychosocial well-being and behavioral problems. Looking at another recent study that came out, they looked at they wanted to look at, so we've sort of seen evidence here that screen time leads to negative impact in terms of psychosocial well-being and behavioral outcomes. But also, what about the impact in terms of parental factors? So in this study, they were able to look at, this was part of a larger study that was in Finland, a cohort that they had, and they looked at how parental factors affect the association between children's screen time and psychosocial symptoms. So they looked at children's screen time and their psychosocial problems, but they also looked at parents' depression, stress, and parenting style. And they used, in this study, they used a percentile rank to distinguish high screen time. And in their sample, they used a 75 percentile cutoff for those to group people into a high dose of screen time. And in their sample, high screen time exceeded 88 minutes per day. And so on average, the high dose group had about a range of between 88 and 240 minutes. And the low dose had a range between 15 to 88 minutes. And so they found that high levels of screen time in children was associated with attention and concentration difficulties, hyperactivity and impulsivity symptoms, as well as internalizing and externalizing symptoms in their sample of 5-year-olds. And these associations remain significant despite controlling for a whole range of different factors. And when they also controlled for parental mental health and parenting style, and as I said, these whole background series of background factors. So, and in fact, they found that when they control for parental mental health and parenting styles, all these relationships still held, but what was really robust was attention and concentration difficulties. They also found that maternal stress and depression moderated the association between children's screen time and psychosocial symptoms, indicating that children had there was a more pronounced association among for children who had stressed or depressed mothers. So I just gave you 2 graphs just to show you how that effect looked, but this was true for all sort of the different hyperactivity, behavioral problems, attention difficulties for that. So you see here that when mothers were depressed, you see a much more pronounced effect, and also when they were stressed. So what this suggests is that when looking in clinical practice, it's not just looking at the screen time. Obviously, that's an important factor. The evidence is showing that if their children are watching a lot of screens, spending a lot of time with screens, that has may be impacting them, but also looking potentially at the parents' mental health as well. Like I said at the beginning, we need a lot more research to look at the long-term effects. We are only starting now to get some longitudinal research coming out, some of the data coming out. I think a lot more will come out in the next few years. But in one study, that was a longitudinal study, they had children who were 6 months old, at 2.5 and 4 years of age. And they looked at, again, high screen time use, excessive screen time use, and they defined it at 0.5, 6 months, years of age, as anything greater than 0 at that age. At 2.5 and 4 years, it was any screen time, high screen time, excessive screen time was anything more than 2 hours per day. And they found that, looking across the ages, that about 45% of the sample at 0.5 years, so 6 months, had what they defined as high screen time, excessive screen time. At 2.5, they had about 55.5%, and at 4 years, it was 34.5%. So after controlling for confounding factors, they found that high level of screen time at 6 months was associated with abnormal emotional symptoms. And this was true for both girls and boys, but it was even more stronger in girls, especially true for girls. And also, they found that it was associated with hyperactivity, and this was especially true for boys. At 2.5 years, they found the same effects for emotional symptoms and hyperactivity, but no longer any gender differences. And at 4 years of age, they found that boys' excessive screen time was in terms of conduct problems. They had more conduct problems, more peer problems, more hyperactivity, and more pro-social problems. Girls also had a trended towards this. They particularly had higher conduct problems, and overall sort of total difficulty score was higher. They also looked at sustained excessive screen time. So if there was sustained high doses of screen time across the cohort, across the time span. So at 6 months, at 2.5 and 4, and they found that children who had continuously high screen time had a significantly increased risk for abnormal total difficulties, for conduct difficulties, for hyperactivity, and also for peer problems. And this effect was seen for both boys and girls. So boys and girls didn't differ, and they had these higher scores for all of this, conduct problems, hyperactivity, and peer problems, if they had sustained excessive screen time. So we see that screen time, there's evidence showing that with young children, it has a negative impact on their development, that parental health, mental health may moderate that relationship, and that this compounds over time with excessive screen time. Research is also suggesting, kind of to summarize, that, there may be a number of risk factors, family and socioeconomic factors affecting screen time and its impacts, and certainly more research is coming out on this. And as we get more research, we'll get sort of greater kind of clarity and nuance on what the degree of risk factors. But some of the risk factors that have been suggested in the research thus far include lower family income, high family TV time, smaller living spaces, one sibling, greater maternal pre-pregnancy BMI, lower maternal age, not predominantly breastfeeding, and lower maternal education level. However, I would caveat that a lot more research needs to be done to see over a number of studies if we see these risk factors consistently. So what about the child, factors related to the child? So child factors, there may be child factors also associated with screen time. For instance, research shows that infants with poor self-regulation at 9 months are more likely to have increased screen time at age 2. So children's dispositions, for instance, have been found to predict screen time. So children's dispositions towards pleasure-seeking behavior, surgency, and negative emotions like showing anger and frustration have been found to impact media usage. And this may be because, with children in this case, parents are using as a screen time as a coping mechanism to deal with their child's dispositions, because they don't know how to handle these the children's temperamental profile. There's not a goodness of fit in terms of the parenting style and the child, and the parent is resorting to screen time as a way to deal with this. There is some evidence that these associations between child temperament and screen use are stronger in families which have greater social risk. I also want to note that another way that is of concern for how parents may use screen time is sometimes parents and caregivers can use media and other devices as a way to, as a calming tool for children. And so if the child is, acting out or having a tantrum, they might try and give them a screen to kind of pacify them or calm them down. Also, another way is to just to use it as a behavioral regulator. I think, a common sight, I've actually seen it a little less now than I used to, but a common sight was, I'm a parent too, going out to a restaurant. When you have a young kid going out to a restaurant, you have to be on top of it. It's not necessarily the most relaxing meal as compared to when you didn't have young kids, but seeing parents kind of just give their kid a screen to watch at the restaurant to keep them quiet so they can have their meal. And so it's kind of being used as this kind of regulator for children. And we need to be cautious of this kind of use of screen time. One study, which was done pre-COVID, is a 2016 study that reported on this. They reported that in their American sample, they reported that 40% of children were offered mobile technology as a comforting tool when upset. And according to the Canadian Pediatric Society's review, they reported that frequent use of a phone to reward or distract children between 1 and 4 years of age can lead to children actually asking for the phone more and then becoming upset if the phone is refused. And so it can lead to this vicious cycle where you actually have more problems with the child having tantrums and getting upset and negative affect over time. So a strong recommendation that they made is that the routine use of devices to distract or calm may actually preclude children from developing the self-soothing strategies and lead to actually an overdependence on screens for emotion regulation. So this is something to be aware of, that it actually can be, parents can use this as a band-aid solution in the moment, but if it's one that they're using a lot, it actually isn't helping the children learn self-regulation and self-soothing strategies. And, that gets back to what I was saying before, is that really for children to learn emotion regulation, and that they really need to do this through sort of co-regulation with their parents, their caregivers, the adults around them, and giving them a piece of technology that may sort of shut them up because they're kind of glued to them, but then as a result, they're not actually learning that skill. And so it gives a short-term benefit, but not the long-term. It doesn't lead to the children learning how to develop regulation. And for that, it really requires the parent and the child interacting together. So that's something to be mindful of in terms of parenting, and how parents may sometimes be using the screens in a way that actually is going to increase problems rather than reduce them. So as I said, disruption, there's evidence that the screen time leads to disruption in terms of child's development and their interactions with the world around them. Just to summarize some other findings, high media use has been linked to less curiosity and self-control, but it's also, may be related to factors with children. So children who have persistent self-regulation problems, this seems to predict higher media use by age 2. So it may be that parents actually use media screen time more often if they have children who are having difficulties with self-regulation. It has also been shown to have heightened risk for dysfunction known as sensory processing disorders. And also screen time at age 4 is being connected to higher dysregulation at age 8. So as I said, screen time is associated with regulation difficulties and behavior problems. And tech-based distractions have been strongly linked with ADHD symptoms. But we have to think about what the benefits of screen time are. But and there are some benefits, especially as children get older. Screens are not something that that can, that are should be verboten as children get older. There may be uses. We are benefiting from screen time right now by being able to connect in a way that we would not normally connect. So we need to recognize that it's not about screen times all bad, 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 bad. We have to realize where they're good and where they're not good. So, and parents too are thinking about this, when is screen time good, when is it not? One thing to note though is that there is really no limited, if any, real documented benefits of screen exposure in infants and toddlers. Basically, I think there's strong evidence to suggest that screen time before 2 is bad and should be avoided as much as possible. And there is really no research to suggest there's any benefit at this age. So we need to keep that in mind, because even with children sort of 2 to 5 or in that young range, any positive benefits that they may be getting from screen time may actually be resulting only happening when there's co-viewing, when an adult is watching it with them, and there may be repeated exposure to the content if it's educational. In fact, what there is, however, documented is this video deficit effect, where basically, any information presented in a video is not as good in quality as a real world interaction. And in fact, because it may be displacing real world interaction, it may actually be leading to this deficit effect. So real world interactions lead to better child learning than any similar content provided by screens. So any learning that may actually be happening from these, from the screens, videos, educational apps at this young age may actually be through the accompanying interactions they're having with the adult around them. And so we have to keep that in mind. And in fact, parents tend to overestimate how much children learn from videos. So it may be that also, it helps to educate parents about what are actually children learning from these apps at this young age. And under 2 years of age, there really isn't any documented benefit. So I've already talked a little bit about parents and parent mental health, but we also need to think about our own media habits as parents. We have to become aware of how we use digital media. Do you reach for your phone all the time during interactions with others? Does it disrupt your interaction with children? What are what is the healthy habits of the digital world that you are modeling to your children? I remember once, this was back some years ago, I had parents talking to me. Now their child was older, youth, but like a young teenager, and they were very worried about their child and their phone use and everything like that. And while we were talking, one of the parents checked their phone several times and sent some text messages while we were interacting. And I finally called them and I said, you've checked your phone several times and we've been talking. I take it this is actually not such an important issue for you. And they were like, no, this is terrible, my child. I said, well, then why aren't you giving the conversation attention? You are being distracted by your phone. And they weren't fully aware of how often they had looked at their phone. It had become a habit on them to just check it and during a conversation. And I said, if you're concerned about how your child is interacting with you, which was part of their interaction, are you doing this when you're interacting with your child? Because you are sort of slicing up the attention and also communicating to your communication partner that you're not fully attending to this conversation. They're not so important. The parent had not ever even stopped to think about what they were doing with it. So it's about the child and the screen use, but it's very much about parents. It's very much about what we're doing and also what we're communicating and how we're setting up the environment for our child. And part of that is, how much we let them use the screens, things like that. But also it's about what we're doing with our own screens. And certainly this is something where we're all kind of swimming in the same soup, I like to say, because we're all trying to deal with these screens and finding a healthy balance and a healthy way to use them in a positive way, but also to make sure that we're not using them in a way that negatively affects our own mental health and our own social relationships. And in fact, this conversation I'm talking about parent, this term technoference didn't exist then, but it does exist now, and that's essentially the issue that we see happening with parents. And it's particularly bad. You can see it with when you go to a playground, you often see the kids are playing and the parents, you're just going to scan around the playground and you'll see some parents kind of watching their kids or, calling out to them. But you'll often see a lot of parents like this, looking at their phones, scrolling their phones. And, this is an issue now that, we have this interruption of the parent-child interactions by technology use. And this is, leads a break in the parent-child relationship and communication. One study I saw in the US where they just looked at sort of physical injury, and they found that the likelihood of physical injury increased when you had parents, engaged in on their technology, because of course they're not even monitoring them at the playground. So there's more likely the child's going to do a nosedive off the monkey bars without the parent noticing, for instance. But it also means that the parent, when you're looking here, your child may be making social bids for your attention, that you're not picking up those social bids. Also, we know that children, learn in this zone of proximal development where they can't master a skill fully by themselves, but through the interaction with another, an adult, a caregiver, they can master certain skills and learn and develop that way. And having a parent who's, I'm not saying parents have to hover over their children, but having a parent that is aware and, monitoring in that can see at those moments that are critical when they can interact with the child and help the child learn something or do something. It's the same with the child learning to make social bids to another child. Sometimes an adult needs to facilitate that sort of beginning of that social interaction to sort of get it off. A parent who's on their phone is distracted and may not be attending to any of these opportunities for the child to engage and interact. And in fact, in this recent meta-analysis that came out, they found that there was a positive association between parental technoconference and children's problematic media use. And they found that moderator analysis showed that this association was even stronger when both parents engaged in technoconference compared to when it was just one parent. And so why this may be is that, children may be engaging in excessive media use as a means of compensating for the lack of parental attention and communication. When parents are preoccupied with technology, children may perceive this as a form of rejection or neglect, and they may then turn to the media use more often as an alternative source of comfort and stimulation to cope with their perceived lack of sort of emotional connection with their parents. Also, another factor is that children may actually learn by observing and imitating their parents' behavior. So it's well known through social learning mechanisms that this can contribute to how children learn by observing the models around them, and it can contribute to the perceived negative and positive consequences of digital media use. So they're also parents are modeling how to engage with these screens. So certainly how adults, how the adults around the children are engaging with screens impacts how children. And so in one study, they reported on sort of media centric type, how parenting orientation, media parent orientation affects screen time. And so media-centric parenting is where there's, a substantial more a portion of the time the parents are spending on screen time, and so as a result, are their children are using more screens. Whereas sort of more media moderate parenting aims to balance a child's use of technology and other activities by and also monitoring the content that the children are consuming. A media light, you see that, media light, that they're not using that media very much, and neither are their children. And when they are using it, it's often just co-viewing. So parents are setting a lot more boundaries around media use and encouraging a lot of sort of other types of in-person interactions, outdoor play, reading, creative play, etc. But we also need to think about sort of the positive consequences that of media use, and remember that parents, often are reporting actually that they screen use is a way for them to feel connected to others and access social support. So this can be a helpful way that the screens are being used by parents, especially if it's used in, to connect with other parents that they'll have live interactions with, like, hey, you want to meet up later after nap time to go to the playground? The kids can play together, we can be together. On the other hand, parents who are feeling very isolated, they may be connecting through these to a support network, and it may be as a result screen time increases because of their isolation. Parents also report using social media as a source of information and advice. So it can be another way to find out information. How many parents have also Googled health symptoms about their kids? But on the other hand, we have to be really mindful of what the information they're getting. We know on social media, we don't always get the best information. And so we also need to think as parents and as mental health professionals, what parents may be potentially using the screen for. They may not have sources of support or are seeking advice, and maybe trying to look there for it. So in terms of for mental health professionals, how to advise and support parents, really research suggests that interventions that begin in early childhood are likely to be the most effective for helping children develop and sustain balanced media use. And so it's important to take a harm reduction approach by informing parents about the uses most closely associated with negative outcomes like excessive screen duration, using the screens at bedtime, using them at meal times, and sort of suggesting that they don't use them in those ways, but also forming them what are healthy screen use habits, like limiting the amount of time to 1 hour per day if we're talking about over 2 years of age, sort of the young preschool age, the importance of co-viewing, etc. And encouraging parents to use a media plan to help establish healthy media routines and also screen-free activities. And also we need to be mindful that we need to think of parents' habits. Interventions also need to target parents' own screen use, as this is a strong predictor of children's screen time. Anything that we do needs to be sort of multi-dimensional approach, in that we need to consider screen time duration, but also the content, the context that the screens are being used in, and the nature of the use. Is it being used to deal with the child's tantrums, for instance? And this can better inform a harm reduction approach by helping us identify patterns or profiles of children's young media use, and then be able to provide support, targeted support. We also need to think of the characteristics of the child and the family, and how this may be affecting susceptibility. And also we need to, certainly more research is needed to fully understand the mechanisms that may be leading to the negative impacts of screen time, like displacement and social learning, and keeping that in mind as we sort of develop a plan with parents. We also need to, it's important to note that schools and daycares also can contribute to reducing harm from screens. Some research suggests that, these can be quite common in childcare settings, media-based activities. And so we really need to advocate for not using screens in childcare settings or limiting the amount of screens in there. And that includes sensitizing early childhood professionals on the potential risks associated with intensive screen use in early childhood, and promoting screen-free alternatives. Childcare and preschool settings, early childhood settings are great places for children to be engaging in screen-free alternatives that are diverse and are engaging activities. This can be, physical play and sports, activities based on the arts or nature exploration, basically activities that have hands-on learning. In terms of providing guidance and support for families, we need to be health care providers and early year professionals should be aware of screen media's earliest impacts and offer anticipatory guidance on healthy screen time practices. So even if you're not seeing problems, if you're talking to parents, you can help them in sort of educating them and providing them with some of this information so that they have the information at hand, reliable, good information that they can use to make their own decisions, rather than having to resort to whatever they find on the internet. And emphasizing that early childhood is this critical window for prevention of sort of problems, and it's a critical window for learning. And more and more evidence is really mounting that early childhood can be this time to prioritize interventions that prevent problematic screen use. And encouraging caregiver involvement and interaction can help families use digital media in positive ways that are more educational and safe. So in terms of more specific recommendations for families, this can include, to be mindful about the use of screen time. So I talked about this, developing a family media plan. This can be, they can write it out. There's, I believe, the American Pediatric Society, I believe they have like a downloadable form or PDF or something that you can use, but it can be written formally out or not necessarily, but developing some mindfulness about how you're going to use media in your family in a proactive type of way. And that involves conducting a self-assessment of, your current, as a parent, your current screen habits, your family screen habits, and developing this plan of when, how, and where screens will be used or not used. It also means developing a plan to prioritize shared family media over solitary child use of media. So doing things where you're working as a family or watching or engaging online. And also really it's about remembering that to emphasize to limit screen time. Also important is the to think about background media. Background media has been shown to reduce attentional focus, and it's linked to lower quality, less complex play, and poor language development. So we really need to sensitize parents to think about, do they have the TV on, always on? Are children watching TV while they're like eating during mealtime? And to reduce that sort of background media, which is having a negative impact also on children. As I said, minimize, limit screen time. This should be really emphasized, that there should be really no media use under 2 years of age is recommended by the American Pediatric Society, the Canadian Pediatric Society. The research really backs that up. Ages 2 to 5, limiting to sort of less that 1 hour up to 1 hour a day. Avoid routine screen time in children under 5 years of age. So don't, don't use it as kind of like a babysitter. And including daily screen-free time. Have times where, especially if you have multiple generations of like different people in your family, they're engaging in screen times at different time, but there should be some time where you all come together and there's no screen time. Like for instance, mealtime, put all the screens away. The phone doesn't need to be at the table. You as a parent do not need your phone at the table. Have some time where the phones, the tablets, the TV, everything is off and you're just interacting, engaging with each other. And this is a really great habit to develop when children are young, because they learn to be socialized. They learn just basic skills about how to eat a meal with their families and how to engage in conversation. But as children get older into the teenage years, this may be the one time that in the day when you're all going your different ways where you're connecting. So really emphasizing the importance of screen-free time, and I particularly advocate for having screen-free mealtime. Limiting screen time to joint use as much as possible with young children. So using the screens together and actively engaging with your child, talking about what you're seeing them, asking them questions, repeating, sort of explaining, because if children are just passively watching, they may not actually be understanding what they're watching. It's actually through the engagement with the parent that they may actually get anything out of that screen time. And also making media time a predictable thing that you do. So for instance, in my case, I waited till about age 3 to introduce screen time. And then it was a very specific time in the day where we watched like a 15-minute program. And it was that was the time of day. It was the only time of day where we really were engaging in that screen time. So making it predictable, this also helps with routines with children. It makes them understand that the screen comes on at this time and the screen goes off at this time. And also being aware of content, preview all media content. So I remember watching a number of different programs before I decided what it is we were going to watch. And then we watched that program together. So preview all media content, prioritize educational, age-appropriate, and interactional programming. Be wary of educational apps. This is kind of unregulated in terms of anything can claim it's educational, and sometimes that's just marketing. And, mindful that research shows that for very young children, these are no good for them. They don't do anything for them. And because they may just be displacing actual interactive play with peers and adults, this can actually have negative impact. So curate your viewing and playlists, if you're using things like YouTube, for instance, to make sure that there's good content that the children are viewing, and also to limit children's exposure to advertising commercial content, because they might be watching something that's, educational, might be harmless or positive, but then they might be limited to negative content through this advertising and commercial content. And if you can't preview, then at least be close by and monitor. Just don't leave them sort of on their own to engage on and watch this content. Also, adults need to model healthy screen use. So parents are the models, parents are the most significant social agents in children's lives. So what we do makes a big difference. And we need to think about limiting and monitoring our own screen use. If you're using your phone in your bedroom, you don't have as much credibility when you go to your teenager, and hopefully you're not giving it to your preschooler to soothe them to go to bed. But you have to think about what you're also doing with your screen time and how you're modeling it. So, as I said, don't have screens on in the background. And when you're participating in activities with your child, put your phone down. Unless you're like, you're on call or something. And then you can verbally say that, I have to keep my phone nearby because X may call and I need to take that call. Otherwise, show that you don't have to have your phone nearby you for all times. And in fact, it can interrupt and disrupt your interactions. So turn off screens during family time. And make sure that there's time together. Avoid using screens as emotion regulators. Do things and help parents to develop strategies that support them helping their child develop self-regulation skills without relying on screen-based media. Shared reading is a great activity to encourage that parents should do. Again, just like mealtime is like a life hack for all parents, having mealtime all together as a family, 1 meal a day. Reading together is a great thing to do from a young age. It can be part of your bedtime routine to help soothe and calm down, or it can be during the day. But reading together is this quiet time where you engage together there are so many great books out there for young children, and it is something that parents can maintain as their children get older. I now am a parent with, I'm no longer in the preschool age. We're like on the cusp of teenage, but we still actually do share a read time where we read things out loud. The content has changed in what we read, but we read chapter books, and now we're reading some really fun what if science books together, and it's still some time that we share together. And it's really good for children's language skills, but it's also really good for the social bond between parents and child, but also developing things like empathy. They can start considering the perspectives of different characters and their feelings, and why did this character do that, and what made that person feel that way. So it can be really a great way to start those kind of conversations. Also focusing on doing things like interactive play, which can, really help children's executive functioning and help them in their self-regulation, doing these types of time together activities. Making sure that, screen time does not displace what children need to do. And if you think about it, what is children's job in the preschool years? It's play. Give time for them to have play, experience, playing with real objects in the real world and with real people. And, traditional play can involve, you don't need expensive toys and things like this. It can be with simple materials like blocks, water, paint, clay. It can be outside, with a stick, poking leaves, looking at an inchworm, building a fort with leaves and sticks, or, if you're indoors, making a fort with pillows from the couch so it's messy for a little while. They can clean it up later. Let them engage with the real world and also engage in their imaginations. So creative and imaginary play is really important at this age. And so giving them opportunities and space to do that with their friends and with adults is great. And again, they don't actually need a lot. Children are programmed to play outdoors, indoors, with all sorts of activities, but allowing space and time for this kind of type of play is really important, what children need in terms of both their cognitive and their social emotional development. And prioritizing face-to-face interactions. I've said that repeatedly, but it just bears emphasis because that is what they need in this young age. Engaging in interactions and regular conversations with people around them. And finally, to go back to reminding that parents, we live in a network of social support and relationships, and that's really important. That children are developing within this environment of relationships. And, making sure that parents, that's important. If parents are isolated, this can impact them negatively and can lead to maybe heightened impact of screens and heightened use of screens. So it's really important to nurture those social support and the social relationships and have the child interact within that, but also in terms of the support of the parents, that the parents have that sort of support network behind them. And also, it's really important to, I sometimes come across parents that are like, oh, they feel like they feel bad because they realize that they're not using the screens the way maybe they should be. I don't think it's helpful to shame parents. We have too much, there's too many things for us to be concerned about, that we don't need to go around shaming parents on their screen use. But we can help each other with this. Parents can help each other, and mental health professionals can help parents in developing better screen use. It's never too late to start. So, even if you have a parent of like an 8-year-old or a 13-year-old, it's not too late to start. And it's important, though, that they, help them to take a slow step-by-step approach. Think about, how is the media being used? How can we make small changes? Develop a media plan, break it down into steps, take each step at a time and test it out. And when there's setbacks or problems, just problem solve them. Don't falling off the bandwagon doesn't mean that you can't get back on. All of us do that at times. I know that I've done things that I'm like, oh, I shouldn't have done that with my screen. Put my phone away. I have to tell myself, self-talk, to remind myself sometimes of what's the best way to do that, because we're living in a very digital world, and there are constantly new sort of noise that's coming out of us. All of us are experiencing this. This is really emphasizing that, it's not about perfection. It's just about being mindful and developing habits. And when we notice something that, oh, not right, we can problem solve it, we can figure it out, and supporting parents in this. And remembering that it's never too late to rein in media use for all of us. And in particular for parents of small children, at their age, it's really much more easy to make meaningful big differences with young children. So even if they have been using screens, they can find a way to not to sort of develop step-by-step approach to not using the screens as much. And they really have, parents now of small children really have the potential that their children are growing up as digital natives. So these children will always have had screens in their lives, and they will become parents. Unlike the parents now, where we didn't have the digital screens when we were growing up, of the proliferation, these children will become parents who came up in this. The parents now of early children, we need to empower them to know that they can teach their children to grow up in this digital world, where their children can learn how to use these tools effectively in a positive manner, without all the negative detrimental impact. So it's really important that we empower parents and not to shame parents, because I don't think that helps them at all. And in fact, if anything, can lead to more excessive sort of screen time use. So that's where I'll end, and I'm happy to take any questions.
Fantastic. Thank you so much. So we have several questions, so we will do our best to get through as many of these as we can. So Julie had asked, does displacement data also include children who, although not necessarily exposed to screens themselves, but their parents are overly engaged with screen time, which is different than any generations of parents before? So you were just talking to that, I think.
Yeah, and so displacement theory is really being put forward as how the screens negatively impact the children for how they they engage with them. But it does impact, although not necessarily originally when it was originally suggested, it does speak to parents because the screen is still displacing. It's not the child necessarily watching the screen, but because the parent is watching the screen, they're not then interacting with the child. And the displacement is the displacement of that parent-child interaction. So this is the thing that I think in recent years become more aware about the impacts of parent screen use and sort of the interference that it can have in terms of the parent-child relationship when the parent is excessively using the screen and not attending to the child.
Nathaniel asked, with the differences in functioning because of the increased screen time, was there a higher correlation with neurodiversities like ADHD? And I know you had mentioned that, but do you have
Yes.
any to
So
add
there's
on?
the research is suggesting that it is correlating with ADHD symptoms and that they may be leading to more symptoms. We need more longitudinal data to really make that causal link. So I wouldn't say yet that there's definite evidence that screen time leads to more ADHD. We just know they're associated with each other. And more longitudinal data will give us a sense of that.
Okay. And this is, again, neurodiversity. This person asked, can you speak to excessive screen time for kids with autism? So many of the families they work with struggle to keep screens away from their children since the kids may only regulate when given a screen. So again, you talked to that as well. But with
Yeah.
autism, is there any research on that specifically?
There's less research, but there's some research. It's the same impact in that it's very tempting because the children may be, um, wanting to engage with it, but again, it doesn't. It can be displacing what they need in terms of interactions with adults with them, and also maybe leading to their way of regulating. And so then they, if they're still not is still not work being done in terms of their regulation skills. Like if it's displacing that, then it's having a negative impact. So, and that I was trying to speak to that, like, parents may be using it partly because it is helping them in at least in that short term with the regulation. And it does help in the short term, but it can lead to that kind of vicious cycle that long term, it actually isn't helping.
Julie has asked, it's interesting that schools are relying more on screen time as well in a day, and with young children as well. She's wondering if it is known or being explored as a contributing factor to disruptive behaviors in school.
Yeah, I mean, there is some evidence that, there's evidence I spoke to, that it's related to more externalizing behaviors. I think what happened in COVID was like, I think screens crept into our schools even more. And there are some benefits to screens in some contexts, but again, not with the younger children. So that's why I was saying with the very young children, there's really no benefit. And we should advocate strongly not to have the screens for the very young children. But also, for the sort of daycare, preschool settings, limiting it to like an hour or less, because there is, again, the evidence I think has come, there's enough evidence to suggest that there's some potential negative effects, especially when we get to more of it. And it is linked on cross studies. In terms of internalizing difficulties, there's some research for, some against, some that didn't find it, but externalizing, that seems to have comes out repeatedly.
And I know Monica has several points here, but just I know I've seen there's some other questions. But one thing, and I think that you definitely have talked to this, but I wonder if there's anything else to add. So she says digital use affects the natural order of milestones in the very young, as we know. And then is this something that we will need to adapt to in the future? So is there any research or information out there, like, and I know you've shared some tips definitely that we can share with the parents and the caregivers, but I like as a grandmother, so I FaceTime with my granddaughter in Calgary because that's
Mm.
the only way we can interact. And so
Oh,
I'm
yes.
nervous about, oh no, can we not do that? Like, so
Yes, I'm so glad you brought that up because I realized I forgot to say that. I wasn't, I meant to say when I had that picture, there was a picture of a mother and a child doing a video chat. And part of the reason I put that up there was to say that there is a caveat with video chat. So as you spoke to, and a lot of people found, I know I did during the pandemic, this was a way to keep families connected. We were able to speak to grandparents and keep that connection going. And so there's not a lot of research on video chat, but there's a couple of studies, and as a result, some experts are caveating that, when they talk about the limits of screen time, they say some of them are saying, well, we're not including video chat in that because video chat may actually be helping to maintain these social relationships, and it tends to be interactive too. It's not passive screen time, and it's usually done with like the adult there. So there's an adult on one side, there's an adult often with the camera, like it showed in the picture, and then there's an interaction going back and forth. So it's not necessarily you want to replace it so the child's only doing video chats, but it seems like it maybe not that harmful, and not necessarily included in those limits of screen time.
okay. Well, that's a relief to me, I'll tell you. Okay. And I'm hoping that, where are we for time? We still got a little bit of time. Does screen time include using an AAC device? And I'm sorry, I don't know what AAC means. Do you know?
Don't either.
Okay, Kaylin, and maybe if you could put that in the chat, we'd appreciate just an explanation. And then Marguerite says, I've really enjoyed the presentation. One thing I feel needs to be examined here is the well-being of the parents. Often this is a default because parents have their own problems with media addiction, mental health, regulation, etc. Putting them in front of a screen solves their own short-term problems. So then the issue is also how to help and refer the parents to seeking out resources to help them.
Yeah. So, yeah, and I think that's an important thing to think about is the parent variables in here in terms of what's happening with the parents, what their screen use is, and potentially how their mental health is. So parents who are feeling socially isolated or depressed or stressed may also be using screens more.
And AAC device is augmented alternative communication. So like an iPad
Okay.
screening. So
Yes, I can't tell you actually. I don't know what specifically the guidance is on that. I will say that with very young children, what the research shows with very young children, so like up to about 2, that they don't learn as well as they do with the face-to-face interaction in that case. So it is better, but I can't tell you specifically. I'm sorry.
thank you very much. I think all the questions, lots of great comments here. Monica had shared, I set boundaries with my grandchildren on cell phone use. When we are together, I don't allow them to use their phones unless they politely say, Grandma, do you mind if I respond to this? Just take me a minute. I like to think by this approach, they learn to respect those around them and how their cell phone use is distracting to in-person interactions. And so, yes, I think you definitely talked about
Yeah.
that.
And that's a great way.
Modeling.
I think that's a great way because you're modeling it, you're creating boundaries. Also, as the children get older, it's they learn to use it in a much more respectful, mindful way. That because they're asking you, they're thinking about it. Like, is this a time to ask grandma about this? I mean, one important thing is I don't think we should be using screens with young children. I feel quite strongly about that as an advocate for not using screen times with young children. But when children get older and as we get into the youth age, I think it's important to be realistic that these screens exist and we need to teach them how to use it healthily. And it's going to be a part of the rest of their lives, as far as what we can see. These screens aren't going away. So it's about not being sort of like, oh, can never have it. No, it's about learning how to use it in a positive, healthy way.
Great. Okay, 2 minutes left. So Chris says, this is such great information. Thank you for bringing it forward. Would you have any evidence that supports if even with all the parameters to limit use on use as infants, that as young children, sorry, I'm not reading this right, that as young children and into adulthood, they may engage in overuse of screen time. For example, limiting time as feeling like they have missed out on moments and then they overindulge later versus background information, background noise. Sorry.
I don't know if there's any longitudinal data. I haven't seen it, that there is. It's an interesting question of like in terms of like pattern usage over time, how it is. I mean, I think that we a lot more research needs to be done because we know what we do know is that some youth do develop very poor poor usage, right? And we're talking about potentially digital addiction that's developing in youth and adults and things like that as well. But there needs to be more research. So we know that not all the studies always clearly show, like there are mixed findings still a lot in the studies. Like I reported to you some studies, but sometimes the relationship is not found with certain predictors, and sometimes it is. And that's because we've had a lot of research over a time span where things are changing. And so even the studies before COVID and after COVID, now we're sort of getting, I think it is changing the landscape, how frequently people had phones and screens kind of like in 2015 is different from 2025. So this also accounts for differences and findings. And so I really do think in the next 5-10 years, we're going to get a lot more data and a lot more understanding of like what relationships hold over time and get a better sense of the patterns.
Well, we are out of time. Thank you so much. As you can see from the questions, lots and lots of people interested, lots of thanks coming in. As a reminder, the recording will be going out. I will attach a PDF of the slides. It's going to take us a few days, so may not even be until early next week. But as soon as it's available, it'll get shared. When you close off this Zoom meeting or webinar, a survey should come up for you. So please, we really appreciate input on how this went for you, but also if you have ideas for future webinars. And Victoria, thank you so much. This was just a wealth of information. And I know I was trying to watch chat and questions, but making my own notes as well. I've learned a lot, and I really appreciate your wisdom and knowledge and being able to put that into words that I could understand. And thank you for letting me feel comfortable about screen timing with my granddaughter, because it's the highlight of my day. So
Good.
All right. Thank you everyone for joining us, and have a wonderful day. I hope that your afternoon and evening are full of sunshine and smiles and happiness and no screens. Enjoy your time. Thank you. Bye-bye.